6 starts now.
Good evening, I'm Renee Cooper. Thanks for joining us for KX News at 6. Leading our coverage tonight, Governor Burgum says the state is working diligently to raise hospital capacity. Burgum says they're broadening their modeling team to address this concern. The governor says they're working with Vermont as well to help make decisions on modeling. Burgum says there's a lagging effect for those who finally know someone who is affected, and that affects people's behavior. He says human behavior affects the rate of spread. Burgum laid out possibilities and models of the rate of spread in the state. The governor says when we look ahead 3 weeks, we could be at a 6 to 13 time increase, meaning 600 positive cases are up to 1,300 positive cases. He says we could have less cases if North Dakotans follow the directives given.
Will we take advantage of the extra time we had to learn and look what other states have done, and will we change our behavior accordingly? Or will we presume that, hey, because it isn't here yet, it's not going to come here, and then we'll continue to ignore orders that will, hasten, if they ignore things that would, and do activities that would hasten the spread, or will we actually be smart enough to utilize our lead time to change the behavior?
When we plan for hospital capacity, Burgum looked at other states and countries where about 20% of positive cases needed hospitalization, and about a quarter of those cases needed intensive care treatment. North Dakota National Guard Major General Alan Dorman says the Army Corps of Engineers will be here next week to look at possibilities for hospital capacity and other planning, including a look at medical equipment. Right now, there are 408 ventilators in the state. Well, Governor Burgum announced 26 new cases of COVID-19 today in North Dakota. Total positives now sit at 94 cases. There are now 16 people hospitalized and 18 people are listed as recovered by the North Dakota Department of Health. Governor Burgum says he believes for every one person who's tested positive, there are probably another 10 positive cases that have not been tested. Burleigh County sits with 28 positive cases, 18 in Cass County, 13 in Morton County, 9 in Stark, and 7 in Ward County. There are now positive cases in 18 of North Dakota's 53 counties. A total of 2,892 tests have been conducted to date. Well, nurses across the country are